Good morning, everybody. I can't see or hear what's happening in the room, but by chat, I'm hoping that you can hear me and see me. Thank you so much for inviting me to your Health and Culture event this morning. My name is Pippa Jones. I'm the founder and creative director now of Gloucestershire. So, as it says on the tin, we're based in Gloucestershire and we're a catalyst for creativity. We want to wake up agency, capacity, and the sense that more people can be creative every day across the county. So I've been asked today to talk particularly about our work to join the dots between arts and health, to enable more people to access an arts and health offer, and how we've gone about that in the last really 10 years of working. This is a great slide to sum up the first thing I want to say, which is about how it's important to take time to stop bumping, to think of another way. So how can we improve health and well-being? How can we do that with arts and culture? It's a culture shift, it's an innovation challenge, and that takes time. It's not about working hard, it's not about doing more of the same, it's about really thinking outside the box. So one of the first things that we had to do in Gloucestershire was just create some time and space for people to think differently. And as everybody in the room I'm sure will know, when you're super busy, you're delivering a multitude of programmes with a huge number of different priorities. It's really hard, and we can all feel a bit like Winnie the Pooh, that we're just bumping down the stairs, and it feels like there must be another way, but we don't have the time to actually work out what that might be. So I think the thing to say was the culture shift, the innovation that we're pushing on at Gloucestershire is that investment follows wellness, not illness. It's widely accepted that health is determined by a range of factors, but predominantly money goes to the bottom right of this slide, otherwise in terms of health services. There's less capacity, there's less resources for money to go into some of the things that grow good health and well-being and prevent illness. And that's obviously where arts and culture sits. So that's why it was important that we were able to talk about shifting that medical model to also complement it with a creative model. So some of the challenges that we were told about that we knew we faced in this kind of change journey was, as I said, the medical model dominates, and that leads to a set of narrow metrics about what is counted and what is measured and what is valued. So a lot of the things that we know artists and arts organisations create, a lot of the value they create, isn't captured in the metrics of the medical model. Things are delivered in silos, and certainly in Gloucestershire, I felt there were system-wide dynamics that inhibited collaboration, inhibited people working together across those silos in terms of working in a different way. So although there were arts and cultural activities happening and they were successful, it was very hard to move those, to grow those, for them to proliferate, partly because one part of the system didn't know what was happening in another part of the system, but also because commissioners need and want scale for their services, whereas what we kept being told by people in communities that they want local and they want bespoke, specific to their particular needs and interests. There's a divide that we felt was quite stuck, a dynamic between those who were commissioned and those who were the commissioners. And while arts and culture has, as I've said, like extraordinary kind of outcomes and reach and depth, it wasn't in Gloucestershire integrated into the system. So that was, these were some of the challenges that we were trying to think our way through and have been thinking our way through. I want to just go through the steps that we took to move and shift. So I think the first thing that we really prioritised was not raising funds for arts and health, but raising friends for arts and health. We used a specific tool which I'm sharing with people at another time around called empathy mapping, which instead of just seeing commissioners as people with money, sees commissioners with a whole range of different values, different ways of working, different motivations, and trying to understand those and really build bridges between artists and health services was one of the main things we did for probably the first 3 or 4 years. So we just focused on understanding and mapping where there was energy, where there was a shared agenda around arts and health. So we then did a series of micro-experiments, some that were very firmly within the medical model to grow evidence that was convincing around reducing people when they have a diagnosis and an illness. So we have done and are still doing experiments in pain, epilepsy, dementia, respiratory. So we worked out through our friend raising what the priorities were for the NHS, and then we looked at where we knew there were artists or arts organisations who were creating really strong outcomes for those patients. And we secured some funding from the NHS to test that and to collect data on that. We also at the same time did micro-experiments outside the medical model, in other words, in those community settings that we saw on the earlier slide, so in schools, in community centres, in parks, in shops, using arts and culture to grow health and well-being by bringing people together to do something that was creative, to start to gather the evidence for how arts and culture can prevent people becoming ill, but also can support people when they have had an illness and have perhaps been in hospital and come back home, to support them with connections with other people in the community, social as well as creative activity. And we started to draw people together into what we've called hyperlocal creative alliances, so groups of people in areas of highest health inequality, which, not surprisingly, also areas of highest cultural inequality. So we bring people together at that very local level, like it might be at a single estate level or a single small village level, to start to work out how to embed art and culture every day. So that's alliances of artists, venues, residents, GPs, teachers, police officers, everybody in the community that makes the community work. I think the other step that's been really important for helping to embed arts and health in the NHS is a carefully crafted data strategy to understand data, to grow confidence and capacity across arts and arts organisations around data, so that we collect data that is what that convinces different people. So sometimes that might be a really good story, sometimes it might be a spreadsheet. So a plurality of ways of collecting data to grow this story and the evidence for arts and culture being a vital part of the health system in terms of the creative model. We've also committed a lot of time to developing talent pathways for artists and arts organisations to, in a sense, broaden who thinks about what a health service professional looks like. So working closely with the NHS to look at how the support and the investment they give into talent development could also go to people who are working in a creative way, both within hospitals but also within communities. So I made that sound like quite a clear step 1, step 2, step 3. So I just wanted to show this slide, which is part of working across a system to create culture change. It's complex, it's messy, it's not, as you can see on the flip chart within that cube, a neat little A to B. Start at A, go to B, go to C. It's much more like the person looking out the door, a lot of squiggly lines that sometimes go somewhere, sometimes don't. So a lot of what we've done has been quite, I would say, if you looked at it from the outside, not making much sense, a bit muddled, a bit messy. So the importance of a set of core values that you hold on to help navigate the complexity, to be able to embrace it, and to be able to work with others to create change rather than you being in control of it, feels like a really important kind of slide to share. And what I think, if we were starting again, with the benefit of hindsight, we would be more intentional about creating infrastructures of togetherness. Like I said at the beginning, the divides between health and arts, the divides between commissioner and commissioned. I think we've now organically grown a range of different forums, spaces that people get together and talk human to human, not in terms of hierarchy or positional power. So we've got a Health Consortium, which is 5 arts organisations that deliver arts on prescription. They work really well together. They're collectively delivering a significant contract from the NHS for social prescribing. We've got the local creative alliances that I mentioned to you. We've got a cultural commission board. We've got a learning circle with the other social prescribers in the county, Active Gloucestershire and the Nature Partnership. We've got a system-wide group called Enabling Active Communities and Individuals. So we've got new infrastructures to make arts and health, culture and health happen, where relationships and understanding and a shared working can emerge, a shared sense of collaboration can emerge. And I think if we looked back and where we started, we probably would have been more intentional with setting these, if you like, groups of togetherness, these structures of togetherness up, and had a greater understanding of the role that we play at Great Gloucestershire of joining the dots. We're not a delivery organisation, we're a catalyst. So in a sense, we're joining the dots between these different areas of expertise and specialism, some county-wide, some hyper-local, some when somebody's ill, some when people are some to prevent illness. And we join the dots across the piece. And I think if we had known what we know now, that's probably where we would have started a few years ago. So that's everything that I wanted to say. Obviously, really happy to have questions or to say anything more, but I'm not quite sure how that will work in this context. So I'll hand back to you in the room.